Hello, everyone, and welcome back to ACT Webinars for Healthcare Professionals. I'm Robin Geiger, CNO for Ingenovis Health. And today I'm really excited. We're welcoming a mother-daughter duo to share their experience with navigating the clinical space of bedside nursing and leadership. This webinar will be interactive, more of a qualitative discussion than a presentation, with real talk about adjusting to new teams and challenges. And now I'll introduce our guests. Courtnay Caufield has 5 years of nursing experience in various areas of practice. She is currently a nurse in the surgical critical care unit at a medical center in Honolulu, Hawaii. She is a shared governance co-chair and nurse mentor, and she works with trauma patients and their families and has an interest in flight nursing. She's a fierce patient and family-centered care advocate. And she's here with her mom, Dr. Courtnay Caufield. She's an executive nurse, board certified as an advanced nurse executive and board certified also in clinical informatics. She is also a fellow of the American Organization of Nurse Leadership and a fellow of the American College of Healthcare Executives. She sits on several boards, one of them being our very own Chief Nurse Advisory Board, and she is the immediate past president of the Association of California Nurse Leaders for LA Coastal Chapter. We're excited to have them with us today. Welcome, Dr. Caufield and Courtnay.
Thank you so much for having us.
So everyone, they may be interested in knowing, so what's going to happen today? It's more of a question and answer format. I'm glad that you're here. You play very well off of each other. We had kind of like a pre-session where we talked. And so we're just going to get right into it and get right into the questions. Are you both ready?
Ready? Yeah.
Okay. So the first question is going to be for both of you. How did your different paths in nursing influence your approaches to acclimating to new clinical environments?
Okay. Well, I can start with that one. And thank you, Dr. Geiger, for having us here today. I think the clinical influence has impacted me acclimating to new groups. Just being flexible. I did a lot of floating when I was a clinical nurse to get started, and that requires you to be out of your element, get into a new group, be able to figure out where the tools of the trade and the lay of the land in the new environment, and then how can you provide the best patient care or do your job. And I think that experience I've used throughout my career as you get into new organizations or a new location or a new role, understanding the what first, and then also the duties, but first and foremost, the people.
Wonderful. And then what about you, Courtnay? How have your different paths? You've been in nursing for 5 years. It sounds like, I mean, you're in Hawaii of all places. It must be really nice.
Yeah.
How do you approach? Yeah. How do you approach adjusting?
Well, I have had a few different nursing jobs in my 5 years, and I feel like the best way to going into a new environment is being open-minded, being open to new opportunities and learning new things and different, like my mom said, different trades. Everyone has their way. Everyone has different skills and strategies that they can, hand off to you when you go to a new place. So I guess the biggest thing is being open-minded, accepting that there's going to be different ways to do things. So just going in and, learning the best you can and, accepting that you have new colleagues around you. So.
Right. Now, I think sometimes we're so hard on ourselves when we go to a new place, we have to fit in right away and we have to know everything right then. So I like that. Just, be easier on yourself. And then Courtnay, I'm going to ask you a follow-up to that. What challenges do you face when adapting to new teams or clinical settings? Like, what are some of the common challenges that you faced and how do you overcome them?
So far as like a bedside nurse or even, being in critical care, you do go into new environments and realize that people, like not intentionally, but have a wall up towards you. So there is kind of like this hesitancy to trust you. So once you enter a new organization, you kind of have to earn your trust, from your colleagues, the doctors you work with, the nurses you work with, all the interdisciplinary team. I feel as if, you know, you just show your true self and are willing to help out and show that you are willing to be part of this team and do everything you can to be the best nurse you can for your patients, then that shows your integrity pretty much. So if you're able to go in, like I said, open-minded and be willing to help and be willing to like integrate what you've learned from your nursing practice into this new facility, I think that's all you can do to like, you know, have a good entering and acclimating to a new environment.
I like that. And I just wanted to remind those who may be watching or those who will watch this later that what's so great about the mother-daughter team also is that you're both nurses, but you're in very different, you have very different paths. Dr. Caufield is the executive nurse and she's in leadership, even though, I mean, she was a bedside nurse, but Sydney, you have a wonderful perspective because you are front line right now, bedside nurse. So I'm really interested to hear these different perspectives. If we could go to you, Dr. Caufield, from an executive perspective, what strategies do you believe are essential just for helping nurses adjust quickly and effectively in new environments?
I thank you for the question. And I do think, actually, I was really thinking through what Sydney was just mentioning. Sometimes you forget how hard it is, even from the clinical bedside, to be new. And the same imposter syndrome exists in the executive level, no matter what role. So remembering the way you're feeling, first day of school type of feeling for anybody when they're in orientation. The organization I'm at now uses it, first best day. And I thought that that was a great thought around, we want this to be your best day, but you don't know anybody, you don't know where you're going to eat lunch, you know, this is a whole new environment. And then you have your job and then you want to care for patients. And so it's just that getting to know the team. And I think from an executive level, it's our responsibility to keep that in mind. There's the business aspects. Let's get through your checklist, your paperwork, all the logistic things, but the human factor in it needs to be put first, and remember the priority and taking the time to really sit down, you know, when welcome somebody wholeheartedly outside of the business part of it, but just as the human. So I think it's really, really important, and remembering new is difficult and hard, but people bring such great strengths. So it's just getting them to open up.
I love that. And so you mentioned something that just was really interesting. First best day. What was that like?
It's different everywhere. But knowing when you're coming into it, that that is the goal of an organization, whatever it may be, to help make sure that you have your best first day. That is something that is important, and it's welcoming, and it's a intentional point to welcome you as a human and start off in a great first step, right foot, in any organization or place. And then people around you, if they know that's the culture of an organization, and as executives, we're responsible to create that. The vibe, the culture, the colleagues and the coworkers also feel that and take a responsibility in welcoming everybody into the best day.
Oh, no, that's wonderful. No, I thought you meant that there was a specific best day routine at your new job. Okay, perfect. How do you practice? This is for both of you. How do you practice how do I frame this? I'm sure your expectations differ. That you're very different. And I know that you probably talk and have sidebar conversations together to support each other, or I would definitely do that if my mom was a nurse. What ways do you see your expectations influencing patient care? And how do you support each other through that?
Mm. You want to start?
Sure. Yeah. I mean, we do talk a lot. It's nice having, you know, my mom being, you know, like she said, she started from LPM to RN to BSN, MSN, DMP. She went the whole ladder. So it is nice to see her perspective because she has had that bedside experience and has went up through management, you know, up into the executive leadership position. So I feel as though I do have an understanding for leadership roles and also from bedside nursing. So we do talk on the side. It does, we do differ and maybe bicker a little bit about our differences, because I think at the end of the day, a lot of bedside nurses and then leadership, I think a lot of bedside nurses forget that leadership was once bedside nurses as well. But like you said, patient, what was your question again? You said about
No, that
patient
it just
expressing
like
an understanding for them.
it just influencing how you care for patients. Like, how do you support each other? How do you learn from each other?
Okay. Yeah.
Yeah.
So that also differs between us because I do critical care, or that's what my passion was. So I went
Yeah.
into ICU, did the transition to ICU. And my
Mhm.
mom was more pediatrics and women's and children's. So very different
Okay.
sides of the spectrum from bedside. But we both, obviously understand and agree on the basics of patient care, understanding, treating the family as if that, as if they're our family. I always make sure that when I have family members to explain every single detail since, the ICU can be a complicated, stressful place and the
Mhm.
environment's very um not very easily understood. So if I can sit down and explain it to the patient and their family, I feel like that builds a little bit of a relationship, some trust, some rapport. And I also think that in just the basics of patient care, like you have to follow your nursing ethics, you have to respect your patient and their wishes and give them the best care like as you can. And with my mom, I think she has this pediatric background and she's really, pediatrics is very family oriented. She's very it's
She's
my
nurturing.
mom's a very nurturing mom at home, and I could only imagine if I was working with her at the bedside, she'd be the same there. So I think at the end of the day, we both agree on the basics of the importance of making your patient feel safe and loved and cared for.
I love that. I can tell you, she is nurturing in work and board meetings as well. So I love
Yes.
that you said that. She took on that motherly role completely. That kind of stayed with her. So before I get to you, Dr. Caulfield, I just wanted to ask you, Sydney, one more question.
Yeah.
I do recall being in the ICU. Oh, very stressful. How do you adjust with making sure that the family's okay and that they understand what's happening while also caring for the patient?
Um, on depending on the situation,
Mhm.
like you said, it can be very intense. There can be in the ICU, we do hourly vitals. We do very frequent assessments where, the day flies by because you're doing so much.
Mhm.
Um, I think one of my priorities always when I'm on shift, if I have family members at the bedside, is every action or every task that I'm doing, I am verbally talking it out loud. I'm never in my head, I'm never quiet. I'm always explaining exactly what I'm doing, exactly what medication I'm giving, what it's for. I'm always reassuring the family and the patient if there's loud beeps, since the ventilators, vitals, the monitors, all the random machines that we have in the ICU, they make a lot of scary sounds. And I just try to reassure them that those sounds are to remind me of what's going on and for them to not worry. And I will, educate them as much as I can and tell them everything that's going on if they wish to know. And I think that also relies a lot on your team. You have your doctors, interdisciplinary team members. I always make sure to try to incorporate as much as I can through the hospital and what they provide. Like we have chaplains, spiritual care, healing hands. So if I can bring those in to the patient to help them out, it's just a stressful environment. So I think as much as I can provide to let them be informed and educated so they can relax a little bit. That's all I can do.
Mhm. No, that's wonderful. And you painted a very, very real picture. I mean, I actually can see myself there again,
Yeah.
at a level one trauma center. You barely get a chance to look out the window to see if it's what the weather looks like outside. I
Yeah.
remember going back outside from the morning to the evening and being completely different. So we really appreciate your service and what you do. Um,
Thank you.
Dr. Caufield, if I could ask you as an executive, how are you, or how do you support your nurses through that education piece for the patient and that nurturing piece for the family members when they're dealing with all of the different changes in diagnoses and situations and procedures?
Yeah, no, thank you. And thank you for the compliment, Sydney. You know, and I think the picture that she painted, like, it warms my heart, because even as an executives, we're putting processes in place. We're making sure the policy
Yeah.
makes sense, make sure quality and safety, we follow up, you know, leaders in any role that consumes their day, and just remembering, you know, the priorities of the family and putting that first, and the clear communication, nursing the most trusted, you know, profession, but also, you know, the importance of communication, is so imperative. And I think remembering that time to do that is what we hear mostly. Like, we wish we had so much more time to spend with the patient, to talk, to play checkers, as I know that was a recent incident, you know, and do these things. And in med search units, like, we're juggling so many patients. We want to do this. How do we make the time? And so I think the burden is on the executive team and us as nurse leaders to try to listen to that, hearing it's most important from both sides, and try to reduce the burden of the tasky type things, so nurses can work at the top of their scope, but also have that empathic care that is drawn to them to be in this profession, to be able to provide that to families and patients. And it makes the experience and their well-being out of the hospital and how they move into their next phase of life even better, as they feel informed and trusting the team that's caring for them, because they're in our hands, you know, and that's our duty to make sure that we do the best we can.
No, that makes a lot of sense. Before we get into our next section, which is on advocacy and nurse well-being, I'd like to talk to you a little bit about that and adjusting to new settings. I know that you have a poll or a question so I'm not sure, is this the time that you'd like for me to launch that?
Perfect.
Okay. All right. So we have a question poll here. So we're going to launch that, give them a little time to answer this. I don't think we can answer the polls as presenters, but we'll see. And I'm going to tell you, they can be really shy, and sometimes we get an answer and sometimes we don't. So I'm seeing, let's see here. I'm not seeing anything yet. There we go. So we just launched.
Don't be scared.
Yeah, we just launched a pulse check. So if you could, it's actually a really cool question. It's, how would you describe your experience acclimating to new groups or teams at work? I'm going to read it. It says, very seamless. I felt welcomed and adjusted quickly. Somewhat easy. It took some time, but I found my place. Challenging. I faced difficulties, but eventually adapted. And then, what team? It's just me doing all the work. That's hilarious. So I can tell you right now that right so far, I've had even votes for very seamless. I felt welcomed and adjusted quickly, and then challenging. I faced difficulties, but eventually adapted. So I'm going to end that poll now, and we'll get started on the next questions. So how do you advocate? This question's for both of you. How do you advocate for your own well-being and that of your colleagues in your respective roles, in your role at bedside, in your role as an executive nurse?
You want to start, Sid?
Sure. So I don't know if we were doing the back and forth thing, you know, you talk, I
You
talk.
can.
Oh yeah.
Either way.
We've already argued.
I guess in my respective role, you know, working in the ICU, like you said, obviously with your experience as well, and any nursing role. I worked med surg as my first job, and that was chaos. You know, it can be very stressful. Whether you're in the intensive care unit or you're on any other floor in the hospital, I think you know that you're caring for someone's lives. And like you said, you want to give your all. And like, to piggyback off my mom, she said, you know, we are empathetic people that joined this career. So we all want to give like, you know, put our best foot forward and show like what we, you know, joined this career field for. I want to give my patient the best experience. I want them leaving. I want them in the hospital feeling safe, feeling protected, feeling cared for, and I want them leaving feeling the same way, knowing that their care is going to continue out. With that being said, the well-being of the nurses coming from a bedside role, I mean, I think a lot of nurses, you know, experience burnout from, which is, you know, it's gonna happen, but it's been an ongoing topic, you know, and I'm sure many different things across like the American Nurse Association has covered it how many times. We all have a hard time balancing that work-life balance. When you put your all into work, you got to make sure that, you know, you are taking care of yourself as well. We need to make sure that we're taking our lunches. And I think that with a, like respectively with a good team, just like my team at the hospital I work at now, we all look out for each other. We're all rounding. Every patient on our floor is our patient. It's even though you might not directly be assigned to them, if some call light or alarm is going off, I'm not going to ignore it. I'm going to answer it. If my colleague is busy or if they need assistance, we all don't hesitate to ask each other for help. And I think that really helps with relieving the stress on each individual nurse and gives us time to, you know, my charge nurse just the other day told me to go sit in the massage chair for 15 minutes and she'd watch my patient. So, you know, it's little things like that.
It's awesome.
You get a little break.
Yeah.
Because someone's willing to, you know, take a step forward and help you out so that I'm not completely burnt by the end of my shift. And she's going to take a little bit of the patient load. So that is very important. I think that everyone has to distribute, you know, the workload and make sure that if you see someone struggling, that you offer help, or if you have a minute to, you know, be there for someone, a patient, one of your nurse friends, that you take advantage of that so that we all end up, you know, being happy in our career, working well together.
I love that. And before you answer, Dr. Caulfield, and I have to tell you, Sydney, I saw your little pet and very beautiful orange tabby.
Oh yeah, sorry.
Poked out a couple
trying to keep
times,
her
and
out.
that's why I laughed. I was like, oh, it was very cute. I just wanted you to know, you know, I've been trying to keep my Sweeney from getting in. It's very cute. It just showed on its own like about 4 times. I loved it. But
She's
no,
nosy.
that's okay. She wants the spotlight.
Yeah.
No, I wanted to ask you, and it sounds like you're doing a really great job with that. Has it been easier after we know COVID was this huge, very real, you know, instigator? It just made things worse, and we already were experiencing challenges, but it made those challenges worse. How has it been like now, post COVID? Do you see more people working better together or closer and really being more empathetic and supporting each other? Like, what are you seeing?
I think it's completely dependent on I guess the nurses in the hospitals that you work in. So it in the hospital I work in right now with, you know, like the team members I work with, I think a lot of people are, you know, burnt out. We've expressed this, you know,
Right.
and I think a lot of, like you said, bedside nurses have, especially the ones that went through COVID in
Yeah.
ICUs, other
Yeah.
units, COVID designated units,
Right.
they were exhausted for doing all this, you know, putting their all into work and, you know, like risking our person, like you said, you know, balancing everything, right? We're risking our
Yeah.
well-being to be there. It is stressful, it's sad, it's hard to see, but you know, that's the career that we chose, and like I want the best for my patient, so I'm going to put my all and all my personality and well-being into that patient to help them out. I think post COVID, a lot of nurses have felt this, not necessarily like a wall, but you know, this burnout that kind of
Mhm.
slowly got better, like with COVID decreasing the numbers and patients returning back to different things, us handling it in different ways. I think the burnout is real. I think a lot of nurses realized how important mental health is and how important taking time for yourself is. So whether some nurses took time to themselves, changed careers, I saw a lot of people leave the bedside. I think I saw a lot of people grow this like anger towards, the medical systems
Right.
for how it's handled. But currently, where I think I'm at and where a lot of nurses that I work with are at, it's kind of this new situation,
We
COVID,
got
it's
this. Yeah.
handled now, we've got it, and everyone's looks back on it like that was a horrible time, but
Right.
we are handling it a lot better now, and we can
Mhm.
be the nurses we want to be.
I love that. Thank you. Dr. Caufield, how do you advocate for well-being? That's hard to follow. I mean, she's
I
good.
know.
Her answer was really solid.
Yeah.
Good luck with that.
One thing for well-being is Sydney not being around cats because she's allergic. So there's one thing as the mom side.
Oh my
So
goodness. The cat popped out like
I'm
4 times and I'm just like,
she's helping another nurse. I think.
Yes,
Yeah.
I'm cat sitting for my nurse colleague, and
There's one case in health
I
issue.
love cats, and I am fine.
Thank you. Anyway, fun in the podcast.
oops,
But
I
yes,
told on you, sorry.
I saw that head too. No, but I think that to your point, and honestly, just to play off what Cindy said as well, from a leadership perspective, one thing I think that was very imperative before and very much now, and you see it and you start forgetting about it, is looking out for others. You need the people who are struggling may not see it. They're go. They're wanting to care for their patients. They're being a manager, a director. They're a clinical nurse. They're an ambulatory. They're running, and they may not see the signs that they need to care for themselves. And so it's our job and really our responsibility to not only to recognize, hey, I noticed that I see some characteristics of you. Do you need some time? Do you need some place to talk? But also recognizing I'm going to intervene because you're not, and you need somebody to step in for you in those times. And we all have them to be able to say it's okay to not be okay right now, but we can help you, whether it's resources, advocacy tools, just like the ACT program, and looking for mental health resources. But even if it's just a break, it's important to normalize that and caring for yourself. And we were having a discussion here the other day when we were talking about for wellness and well-being, a committee that I'm on, meetings are now 45 minutes. Defaulted in Outlook, give yourself time to go to the restroom. You can't be back to back. And the concern is, but it's the old way of doing things. That's not what we're supposed to do. I'm a
Right.
badge of honor because I worked 16 hours today. And so turning the tables on, I was able to go to a doctor's appointment in my kid's game, and celebrating that is where I think as leaders we're trying to move to, and we fall into
Right.
old habits though. And so that's where I think the responsibility is to care for each other. And again, it's just having a phone a friend, looking out for each other. And back into the first part of the question, in the start of this podcast, being in new groups, you may not have that person yet.
Right.
So it may be an external person who you debrief with or you need to decompress with, and they can check you. And I think I'm lucky to have had those people, and also, having family members and friends.
No, I agree. I think mentorship or having a mentor, even reciprocal mentorship. It could be a friend and you mentor each other, but having a sounding board, call a friend, as you said, is important. I like that. Um, Thank you. Yeah, I love that. Now, we talked about how you adjust, and now my other question will be kind of how you help others adjust. How do you blend and support travel nurses, for example? I mean, we have definitely a mixed staffing matrix, hybrid staffing, everyone helping everyone at this time. And so I'd love to know what your experience is with that and how you could help, how do you help them feel more included and just blend well with your teams?
Yeah. I'll start with that one, and because I think we have probably similar but different perspectives, because Sydney and I have
Okay.
talked about this before, and like you said, I have a phone a friend, gosh, I'm dealing with this issue. How do I do this better? Well, let me tell you what the problem is. So, and let me tell you
Right.
why, leaders need your help in doing this from the clinical staff. So we've had that balance, and that's the beauty of this podcast as well. So I think with the travelers agency registry, whatever it's maybe called, union or non-union or environment, system or non-system, and I've worked in a little bit of everything, it is a part of your team member that you're bringing in to co-share patients with you, to use Sydney's kind of perspective that this is all of our patient. The better we acclimate them in, not just to here's the rapid fire checklist, we want to really integrate you into who we are as an organization. Not only helps them be a better clinician and teammate, but also, there is a lot of people who find a medical home when they're traveling because they find the environment, they're testing the water and like that. So putting that front forward investment in travelers and welcoming them in, and not shortchanging the experience because you think they're not permanently invested in your team, has been where I've seen them be very successful. In addition, having special maybe asks, what I've seen work well for travelers who have come in, say, tell me a little bit about where you've been. What have you seen? What other practices are out there? And it's like an encyclopedia of nursing practice sometimes, because they've done multiple things in multiple areas, and it's just a win-win.
Yeah, they could definitely, and often serve as resources. Absolutely.
Yeah.
Sydney, what's your take on that?
Like she said, we have a little bit different, but it is nice to hear my mom's perspective from management, because I don't know the background behind hiring travelers and all that. I know that they supplement, when we're short staffed. We have travelers at my current facility. We had travelers at my last. I do think, personally, as a bedside nurse, I do think traveling nurses are kind of used really as a supplement. I think that they have, like my mom, a lot of more potential. They have more experience. They have a lot they could bring to units. But when they come in, they're kind of the extra help. And in that sense, I think from a bedside perspective that we need to be nicer to travelers. We need to treat them, they are the same staff members that are taking care of the patients. Like I said, they're all our patients. I think at my current facility and my last one, all the experiences I've had with travelers, my closest nurse friends have ended up being travelers. A lot of them have signed on to the hospitals that I've worked at. And I think that means that, like my mom said, they've acclimated to our environment. We've really welcomed them. So that's a good sign. I think some traveler nurses are just feeling out the experiences, but I've heard from them, being my close friends, that there have been some rough experiences in the past, hard for them to blend in, hard for them to get the help because there's this line between staff and traveling. So I think staff nurses, for the most part, like to, or at least for me personally, I love working with travelers. I think they bring a lot of different experience to the floor, and they've seen things that you may have not seen, and they really bring that difference and diversity to the patient population. They, I feel like, are a little restricted in what they can do at some facilities, knowing that they have all this experience. They probably could do a lot more, but just depending on what they're allowed to do, or what, like my mom said, what they're allotted to do is a better way of putting it, because they're put in as extra help.
No, I love that. And you're spot on, Sydney. Some hospitals definitely expand their role of travel nurses, and we love that when that's appropriate. But yeah, I mean, they have the same certification, the same board certification, and same initial training. I mean, maybe not the same training at the health system. They don't know the ins and outs of that specific health system, but thank you. I appreciate that. Okay, so my next question is, we're still on burnout right now, and I know that you have a second pulse check or a second poll. We can launch that whenever you want. But this question is more about just, policy and what support do you wish was more available, Sydney, to bedside nurses to better manage stress and avoid burnout?
I
Magic
think,
world, magic world.
You
yeah,
can
I
have
do think
anything you want, right?
it from a realistic standpoint, it's very hard to avoid that because even with the least amount of stress is different for every individual. Uh, and every patient brings a different level of stress, whether that's emotional, whether that's, you're in a critical care unit and there's a very tough situation and, I can't take my break or I can't sit down and I'm constantly checking, doing these very intense assessments on my patient, taking them from CAT scan to MRI. I think um, everyone's stress level can be different and burnout is inevitable. It's just about how you manage it and manage it on the outside, like you said, in a perfect world, um, we would be able to, I guess the main thing, I think a lot of staff members, what I've heard, at least from my experience and with my colleagues, is we want to give that care. I want to give the best care to my patient and their family. I want to be proactive with them. I want to do the extra step and, I'm bathing my patient. Now I want to braid her hair. Do I have time to do that? Well, if someone's able to manage my other patient for a couple seconds, maybe I could do that for her and change her day for the better.
Right.
And I think that all comes down to staffing needs and
Yeah.
also, like it, I think it all comes down to staffing and that's hospital facility based. I think
Right.
if you are able to staff with the right amount of nurses, then we're able to do that. And like I said, it also really depends on the teamwork and bonding and trust that your colleagues all have in each other. So
Right.
I guess how well your unit works on everyone working together and being close and respecting each other. I think that's also another thing. Policy wise, I guess, I can't think of a specific policy. I guess making sure everyone's able to take their breaks so that they can come back to the unit and give the best care they can. They have to refresh themselves so they're not burnt out during their shift, as well as policies in the sense of patient acuity and, back to staffing, like I said, you have to make sure that the nurse ratio is appropriate so that we can care for the patient in the correct way. I understand that we go through times where we, more or less have good nurses, or the good amount of nurses versus like maybe we're short staffed. So that's realistic, but I guess you said in an unrealistic world, what would I want? So
No, I understand that. Sounds like you would build a lot of culture and that you would, provide a lot more attention to patient care. I appreciate that perspective. Dr. Caulfield, what do you think? What if you had to implement policies or initiatives that prioritize nurse well-being, what would some of those be?
Oh, yeah. Well, and I thought I would hear more vacations from Sydney.
I was looking for that too. I was like,
outside of the hospital, that it does warm my heart when you're given a magic wand.
I love it.
The number one thing is that you want to provide the best patient care. So
That was awesome.
yeah,
not to interrupt you, but
yeah.
excuse me. Obviously vacation time is important too, but
Thank you. Time out.
if you don't have the staff,
Right.
then for example, my current in my experience, we're picking up overtime. I'm staying over late, coming in early for my shifts. I work a lot of 16s, and that's to supplement for, the influx of having nurses or don't have enough nurses. And so when it comes to vacation time, I know we need to prioritize our own well-being, but a lot of times it's hard for me it's hard for individuals to get the days off they want if there's not enough staff. Also, it's hard for people to take, time off for themselves, or, even call in sick, knowing that you're going to, like, I have a close unit. We're all close. We're all in each other's business. I think, if I was to take a day off, that could negatively affect my unit. The nurses I work with, they're going to be short staffed, they're going to be stressed, they're going to be burnt out. And it's this constant vicious cycle. So that's all I'm going to say on that.
I hear you. Well, and a good point. And I appreciate going back to basics. We can't do this if we don't do this. And I think from clinical staff, but also in leaders, we were having this discussion recently. I can't take that day off or I can't take this development class because I have
That's sad.
This investigation. I need to do my staffing. I have a budget to do. I have all these things. I'm so accountable, and they pride themselves in a leadership perspective. We all do. It's that list or the pile that's on your desk. The pile's going to be there tomorrow. What's the burning fire that you created? That you created this, that must be done today, or what really needs to be done so you can reprioritize. And a good friend of mine, Dr. Lawson, shared with me that I have a sticky in front of me. What fires did you create yourself that must be done, so you can really work on prioritization? And I know it's done in patient care, but even in leadership, trying to think of what do we need to get through, and then role modeling that for leaders and for clinicians in a perspective that, we're going to reprioritize what we have to do today. Yes, we need to get this done. How can we help each other out? How can we shift things or focus? Really rebalancing priorities to what's most important, and how does it impact how we do our jobs and our patient care? Because there's a lot of the business aspects in leadership that must get done. That's not fun. But it does impact the ability for our clinicians to be able to provide patient care or have the supplies or the staffing. And so refocusing on that as a group and as a team, and constantly asking, are we focusing on the right things, I think has been a good approach. Because my hot ticket and priority for today may not be Dr. Geiger's priority for today, and so what is the one that we need to agree on is something we need to focus on. And then also bring an aspect into it of avoiding the proverbial, we've never done it that way, or we've always done it that way, and really trying to integrate and being willing to try something new. Whether it is alternative work schedules, whether it is being able to have walking meetings only, or protected time for rounding. It's certain things, there's not enough hours in the day to do everything. So what is your priorities?
No, I love that. And no, that makes complete sense. And I think we're coming close to time. I mean, I really enjoyed this discussion. I thought we would at least share that second pulse check, and I can tell you, a little bit more about, what that looks like for everyone. So I just launched that. If you have, if you're bold enough to answer, I know we have some shy people out there, but if you could answer the questions about how would you rate your ability to incorporate self-care and well-being initiatives into your daily routine? And there is excellent. I prioritize and regularly practice self-care. Good. I make an effort, but could improve. Consistency. Fair. I struggle to find time for self-care. Poor. I rarely or never incorporate self-care. And then there is what self-care? I'm lucky to be out of my pajamas. That's awesome. I love that. Thank you, Ashley, for helping with these. So I'm gonna share the answers, or I'm gonna share the results. So I'm getting most of the results fair. I struggle to find time for self-care, and I think we anticipated we would have that. There is, just some poor. I rarely or never incorporate self-care, and then we have an excellent. We have just one who is excellent at self-care. Right. So thank you so much for those. And then we do have some questions for you. And I know we had additional questions, but once you get into that conversation, I'm really more interested in where we're going with the conversation. But let's go ahead. If that's okay with both of you, we can start. Okay. So the question is, what keeps you going? And this is for both of you. But if we could start with you, Sydney. And I think the question is, wow, that's a really heavy question. Like, what keeps you going, I guess, in nursing and in your role?
I'll try to formulate it and not, talk forever.
No, you're fine.
But I think ultimately, I know, like you said, that's a really deep question. You could go on and say that, it's out of the base of my heart, blah, blah, blah. It is truly rewarding. That's the one word I would say is when I leave a shift and I was able to give my best and make my patient feel just slightly less bad, like slightly better, slightly less as bad as they already felt because they're in the hospital. I always tell my patients that, this might be like the worst time of your life for all I know, or even my patient family members. This could be a very stressful, scary time for you, but that's what my job is for you, is to make it as a little less crappy, a little better, and, a little bit more comfortable. So anything I can do for you, if I can get you water, if I can, pull out the chair for you, for family members, if I can get you a blanket, the patient, if I can do anything, if I can, like I said, incorporate interdisciplinary care. At the end of the day, what keeps me going is that once I do that for my patient, like seeing their smile on their face, and it might sound cheesy, but it really, really warms my heart. And it is ultimately just the best feeling in the world, knowing that someone who's in maybe possibly one of the worst situations of their life feels a little bit better due to my help.
Awesome.
No, I'm
I
emotional.
know.
I'll cry over things like
You should be proud.
all the time. Yeah, well, and like you said, I mean, I appreciate that, Sydney, and it's like in your heart, and people have different approaches of why they became a nurse or why they stay a nurse and why we're in patient care in any role, administrator or in bedside. But I think everybody shows up, I hope, and I assume benevolence. I think that's my approach to things, is you have to assume people are here to do the right thing and do a good job, and take it from there, having a wall up, having your guard up, assuming negativity, or even making judgments about patients. I've seen that and experienced that, and it impacts how you provide care. And of course, you're going to have traits and trends, and you're going to, have experiences that will make you think, well, I've seen this before, or I've experienced this before. But going into it with the human nature of, knowing that we are here and people are entrusting us with their lives, and that's our job. And I think that, like to Sydney's point, when you've had what does a great day look like to you? What's your best day at work? Someone recently asked me that, and I couldn't even answer because there's so many ways. But I think it's feeling accomplished, that something you did that day made someone else's life a little better. Or you improved a process, or you were able to advocate for something that was really important for patients or nurses. And that makes you feel like I need to keep doing this. I think I went into leadership because I thought, I can fix that, or I can do that better. Let me just do that. And then, oh, I like that too. And, squirrel, let me do this. And so when you're a fixer, and a lot of us are nurses are wanting to be fixers, yeah, it is hard when you can't fix something. It's frustrating. And so what keeps you going is knowing that you can make an impact in any role, whether it's making that patient's day a little less bad, or helping them look into having that moment with somebody that they have not had. But the same thing in an executive level. I think that is like the driving force at what brings a smile, gets you up, and is exciting with healthcare. Honestly, there's a opportunity, and I'm privileged in a role where I can make decisions that maybe would not have been made. And so trying to be innovative, trying to say yes to the good, that's been, I think, a joy, and what keeps me motivated and going.
I think it feels good to be the change is kind of the quote. That's the quote
like
I always
that.
see. It's always be the change. And I think it feels good for us to be that change.
I like that.
I would agree. And it's been so great speaking with both of you today. Very inspirational, Sydney. You took me right back there to the bedside as an ICU nurse. And I'm glad I didn't bring tissues. I mean, you said some really impactful things, and so did you. Dr. Caufield, it's been a pleasure. Is there anything you'd want to say before we end today to inspire others?
Let you
I
go.
guess, well, to you, Robin, thank you for inviting me. I
Oh.
haven't had an experience like this. And obviously it's great to do it with my mom, but it's also, it's really nice to talk about like my experience. And you've asked such lovely questions that really get me get me to talk about why I do this. And just even conversations like this, I think to nurses and probably all the people that are listening, doctors, healthcare providers,
Okay.
you get that like reassurance that there's other people out there doing the same thing as you, doing it for the same reason. And you realize that, you're not alone. And it, at the end of the day, it makes me feel really good to do what I do, and talking about it and realizing that, I, like my mom just was saying, like be the change, like that is something that I love doing. And I think others love doing. So it feels good to talk about it in a positive light. So thank you for inviting me on today.
Yeah.
Thank you for being here.
Yeah, I would agree. And, whenever I need a mole, I'll say, Sydney, help. But I think it was good to break out of, the first ever podcast, it brings me as well back to, why we do what we do. I feel very energized after today. And I saw some of the people who are participating and watching on this. One is a colleague of mine that's a co-board member and was Sydney's nursing instructor. And so
I love it.
Is it Harmony?
Yeah.
Yeah, and you're getting all of these, little
Yeah,
hearts and love sent your way too.
She was my critical care, my ICU nursing, my clinical instructor. So
Yeah.
she's
Oh.
who gave me the experience to try ICU and really
Yeah.
told me that she saw this like potential in me and was pushing me to go there. And that's what led me there. And, later in life, you get to all go around, and I understand more from leadership from my mom, and my mom understands more from bedside, even though she had bedside now from me. So
Well, no, I love that.
I love
and you
it
have
too.
some you
Oh,
have
sorry.
some really good I just wanted to share that this was excellent. Thank you so much. From Diane. We have a couple others. Thank you. This was great. Wow. So I just wanted you to know that it was really impactful. And I think doing this, I appreciate that you enjoyed this, because I'm sure that this will inspire other people, and it'll touch them where they need to have that feeling to re-energize them and keep them going in this profession. So thank you both so much. I really appreciate it.
Thank you
And
so much.
yeah, I appreciate it. And I think that's gonna be our close. We're gonna close today. I appreciate it so much. Thank you.
Thank you.